About 1 in 5 women experience a major depression or some other kind of mental health disorder in pregnancy or during the first year after their baby is born. These conditions can have significant negative consequences for the woman, her baby, and other members of her family. As midwives in Ottawa, we noticed that some of the women we care for and care about really struggled to find the help they needed when they became depressed. At the same time, the Ottawa Birth and Wellness Centre was exploring new services that it might be able to offer. We decided to work together and find out more about what women in Ottawa really need when they experience mental health concerns during the perinatal period, and to see if there was a way we could help. Our project involved 4 things: an environmental scan of all the existing perinatal mental health services in Ottawa, a literature review looking at how best to organize perinatal mental health services, interviews and focus groups with women and healthcare providers about their experiences accessing perinatal mental health services in Ottawa, and participatory meetings to share what we had found and to talk about ideas for new services. When we talked to women and healthcare providers, we learned that women really appreciate the kind, compassionate care that they receive from some of their care providers. Unfortunately, we also heard about experiences where women were treated insensitively or encountered healthcare providers who didn't have enough knowledge to help them. Both women and healthcare providers find it difficult to navigate the system. Everyone we spoke with highly valued existing services that specialize in perinatal mental health, but these services are difficult to access. There are long wait lists for perinatal psychiatrists, and not all maternity care providers in the city can make referrals to them. Individual therapy is inaccessible for some women because of the cost. Facilitated peer support can have a very positive impact on women's recovery and help women to realize they're not alone. Women particularly appreciate drop-in programs that allow ongoing support and community. In our participatory meetings, we shared ideas about a community-based perinatal mental health clinic with a multidisciplinary staff that could be a one-stop shop based out of the Ottawa Birth and Wellness Centre. There was a lot of enthusiasm from perinatal mental health service providers, maternity care providers, and women who've experienced perinatal mental health concerns for this idea. Our next step will be to establish a working group made up of a broad range of stakeholders to develop a formal proposal for this clinic. We're hopeful that our project will help to ensure that in the future, women in Ottawa with perinatal mental health concerns can easily access the care they need when they need it.